Hi there, my name is Lori Bossum of A Balanced Life, Greenville, South Carolina. And this video is on why I use evidence-based therapy to help those I work with. Now, most people that come to therapy for the first time are really not aware that there are significant differences in the types of therapy used in the helping professions. I think it's important to educate yourself about the various types of therapy before you hire a therapist. Most people would never think of going to a dentist for a stomach ache, but could quite easily wind up in an ineffective therapy without the proper knowledge and understanding. As a dedicated, passionate therapist of 20 years, I choose to pursue and gain in-depth training, knowledge, and understanding in the types of therapy that will help those I work with make cost-conscious, lasting change in the shortest possible time. The differences in the evidence-based therapy over what is referred to as therapy as usual are the specific techniques and skills used in evidence-based therapy have all been rigorously tested and proven in randomly assigned trials to work as well as or better than medication, a placebo, or treatment as usual. Additionally, the results can be repeated in a variety of settings with a range of people. And the therapist has been sufficiently trained in and adheres to fidelity of the evidence-based model. In other words, evidence-based treatment is based on what works, not just what feels right, or has worked in the therapist's personal life, or is the latest pop psychology fad. The leading evidence-based therapy in the helping professions is cognitive behavioral therapy, CBT for short. Cognitive behavioral therapists are invested in providing you with the skills and strategies that not only help you to feel better in the moment, but to do and cope better in the long term. The basic premise behind CBT is that our learned behaviors and emotions are the direct result of our thoughts. Cognitive behavioral therapists use purposeful questioning and evidence gathering alongside examining the validity and utility of your thoughts as a mechanism for change. We also collaborate with you to establish concrete and measurable goals for your therapy. Cognitive behavioral therapy has been proven to be highly effective in working with such problems as anxiety, depression, or anger. When you choose non-evidence-based or therapy as usual, you run the additional risk of treatment failure or a much longer course of treatment, decreased likelihood to return to therapy if symptoms persist, an increase of symptoms over the lifetime, a decrease in quality of life if symptoms persist, and an increased risk of insurance companies denying claims for therapy. Please, if you have any questions about cognitive behavioral therapy or would like to set an appointment to work with me, feel free to either email me or call. In the meantime, be well.